Big changes are coming to Medicare costs in 2026, and for millions of Americans, these changes could have a significant impact on your monthly budget and your peace of mind. Whether you're already enrolled in Medicare or planning to sign up soon, it's more important than ever to stay informed and proactive. It's crucial to be prepared, because understanding what's ahead can help you avoid surprises and make the best choices for your health and finances. Nearly 69 million Americans rely on Medicare for their healthcare needs, making it one of the most important programs for older adults and people with disabilities. The decisions you make about your coverage can affect not just your medical care, but your entire financial picture. This year brings one of the largest premium hikes in recent memory, and for many, that means stretching your budget even further just to keep up with essential healthcare costs. With everyday expenses like groceries, utilities, and housing already on the rise, higher healthcare costs can feel overwhelming and even a little frightening. It's easy to feel anxious about how you'll manage, but knowledge is power. By understanding these changes, you give yourself the tools to make smart, informed decisions. You can plan ahead, compare your options, and find ways to save money or get the coverage you need. This guide will break down what's changing in Medicare for 2026, how these changes could affect your wallet, and most importantly, what you can do to protect yourself and your loved ones. We'll walk you through the details step by step. We'll cover the new costs for Medicare Part B, including premiums, deductibles, and out-of-pocket expenses, so you know exactly what to expect. You'll also learn how these changes might impact your Social Security benefits, since many people have their Medicare premiums deducted directly from their monthly checks. Plus, we'll explain what's happening with Medicare Advantage and Part D prescription drug plans, including changes to coverage, costs, and the number of plans available in your area. The private plan market is shrinking, with fewer options and higher costs for many. This means it's more important than ever to compare your choices and make sure you're getting the best value for your needs. Remember, you're not alone. Millions of Americans are facing these challenges together. There are resources and support available to help you navigate these changes. The annual open enrollment period is your chance to review your coverage, compare plans, and make adjustments that could save you money or improve your benefits for the year ahead. Let's start by looking at the foundation of your coverage, Medicare Part B. Understanding how Part B works, what's changing, and what it means for you is the first step to making confident decisions. Here's what you need to know to get started and take control of your Medicare coverage in 2026. Medicare Part B covers your doctor visits, outpatient care, and preventive services. In 2026, the standard monthly premium jumps to $200.90, a $17.90 increase, nearly a 10% hike. The annual deductible also rises to $283, meaning you'll pay more out of pocket before coverage kicks in. After meeting the deductible, you'll typically pay 20% coinsurance for most services. These increases directly impact retirees' monthly budgets, as premiums are often deducted from Social Security. About 8% of enrollees with higher incomes will pay even more, due to the Income-Related Monthly Adjustment Amount, IRMAA. For these individuals, monthly costs can be substantially higher. It's important to know where your income falls to anticipate your premium. Let's see how these changes affect your Social Security check. 10. Most retirees have their Part B premium deducted directly from their Social Security check. In 2026, the $17.90 premium increase will reduce your monthly benefit. With a projected 2.8% Social Security COLA, the average retiree may see a $56 increase, but nearly a third of that will go to higher Medicare costs. The hold harmless provision protects some from a net decrease, but not everyone qualifies. New enrollees, those billed directly, and high-income beneficiaries pay the full premium. High-income couples could each pay over $400 per month for Part B. Why are these costs rising so sharply? Several factors are driving up Medicare costs. Medical care is more expensive. Everything from tests to prescription drugs costs more. The baby boomer generation is swelling the number of enrollees, increasing overall spending. More care is delivered in outpatient settings, shifting costs to Part B. These trends put financial pressure on the system, leading to higher premiums. A recent policy change targeting high-cost wound care products will save billions and kept premiums from rising even more. Without this intervention, your premium would be about $11 higher. Policy decisions can help, but broad trends are pushing costs up. Now let's look at what's changing with Medicare Advantage plans. 10. Over half of Medicare beneficiaries are in Medicare Advantage plans, but 2026 brings major changes. The number of available plans will drop by 10%, affecting over 2 million people. Some areas will lose all Medicare Advantage options, forcing residents onto traditional Medicare. Zero premium and PPO plans are becoming less common. More HMO plans will be offered, often with stricter networks. Average monthly premiums for plans with drug coverage will rise from $60 to $66. Maximum out-of-pocket limits are increasing by nearly $500, and dental benefits are being trimmed. You'll likely pay more and get slightly less. Prescription drug coverage is also changing. Let's break it down. 10. Medicare Part D drug plans are also seeing big shifts in 2026. Fewer plan choices are available, and some insurers are leaving the market entirely. Premiums are volatile, some rising by as much as $50 per month. The new $2,000 annual cap on out-of-pocket drug costs is a benefit, but it's causing insurers to adjust premiums and coverage. Carefully review each plan's formulary and cost sharing, as your current plan may not be the best fit next year. Who will feel these changes the most? Some groups will feel the Medicare cost increases more than others. Seniors on fixed incomes may struggle with higher premiums, even after the COLA. Rural residents face fewer plan choices, and some may lose Medicare Advantage options entirely. Those with complex health needs could see disruptions in care if their preferred doctors or drugs are no longer covered. New enrollees in 2026 won't have hold harmless protection and will pay the full higher premium from the start. For many, these changes mean tighter budgets and more difficult choices. So, what can you do to protect yourself? 9. If you're feeling overwhelmed by rising Medicare costs, you're not alone. Many seniors are facing tough choices, but there are practical steps you can take to protect your health and your wallet. The good news is, you have more control than you might think. Each year, during Medicare's open enrollment period, take the time to review your current plan. Don't just let your coverage auto-renew. Plans and prices change every year, and what worked last year may not be your best option now. Compare all available Medicare Advantage and Part D prescription drug plans. Look closely at monthly premiums, deductibles, co-pays, and out-of-pocket maximums. Also, check which doctors, hospitals, and pharmacies are in each plan's network. Use the Medicare Plan Finder tool at medicare.gov. This free resource lets you enter your medications and preferred providers to estimate your total annual costs for each plan, helping you avoid expensive surprises later on. Make a list of your current doctors and prescriptions, then double-check that they're covered by any plan you're considering. Even small changes in coverage can add up to big costs over the year. If you're struggling to pay for Medicare, see if you qualify for financial assistance. Programs like Medicare Savings Programs and Extra Help can help pay for premiums, deductibles, and prescription drug costs, making healthcare more affordable. For free, unbiased advice, reach out to your state health insurance assistance program, or SHIP. These trained counselors can answer your questions, explain your options, and help you avoid costly mistakes. Don't hesitate to ask for help. SHIP counselors, trusted family members, or a licensed Medicare agent can all help you navigate the process. It's okay to lean on others when making these important decisions. If you work with an agent, make sure they're showing you all your options, not just the plans they represent. Ask questions, and don't feel pressured to make a quick decision. Taking the time to carefully review your choices can save you hundreds or even thousands of dollars each year. A little research now can make a big difference in your financial security and peace of mind. Remember, you're not alone in this process. With the right information and support, you can make confident choices about your Medicare coverage and protect your health and finances for the years ahead. As we look ahead to 2026, there are several important takeaways to keep in mind to make sure you're prepared for the changes coming to Medicare. Whether you're new to Medicare or have been enrolled for years, staying informed is the key to making the best decisions for your health and finances. Medicare costs are on the rise. This includes higher Part B premiums, increased costs for Medicare Advantage plans, and more expensive Part D prescription drug plans. These changes mean you'll likely pay more out of pocket for your coverage and medications. so it's more important than ever to review your options carefully. In addition, there will be fewer private plan options available in many areas, making it crucial to compare what's offered and understand how each plan fits your unique needs. Open enrollment is your annual opportunity to compare plans, switch coverage, and ensure you're not paying more than you need to. Take the time to look at all your choices, including premiums, deductibles, and out-of-pocket costs. The Medicare Plan Finder tool on the official Medicare website is your best resource for comparing drug coverage and plan details side by side. Use it to see how your current plan stacks up against new options. Don't assume your current plan is still the best fit. Plan details and costs can change every year, so it's worth double-checking before you renew. If you have a limited income, remember there are programs like Extra Help and Medicare Savings programs that can assist with premiums, deductibles, and drug costs. Don't hesitate to apply if you think you might qualify. For free, unbiased advice, reach out to your state's SHIP office. Their counselors can help you understand your options, answer your questions, and guide you through the enrollment process. While the changes to Medicare in 2026 may seem overwhelming, remember that with careful planning and the right resources, you can navigate them with confidence and peace of mind. Stay proactive, review your options, ask questions, and seek help if you need it. Being informed is your best defense against unexpected costs and coverage gaps. You've got this. Make 2026 the year you take charge of your Medicare choices and secure the coverage that's right for you.